Let's turn our attention now to the Western Cape, where phase 2 of the COVID-19 vaccination is also continuing, but authorities are struggling in getting rural vaccinations going. Today, vaccination program kicking off in Malmesbury in the Western Cape. My colleague Ayesha Ismail is there. She's joining us now on the Midday View. Ayesha, good afternoon. Well, we're getting a sense in Gauteng, some of the centres looks like they're well supplied, but there is an issue, of course, what's happening elsewhere in the country. What are you seeing where you are in Malmesbury in the Western Cape? And I gather you're going to be with the Premier, Alan Winde. He might even be sharing with us at this hour what's happening in rural Western Cape.
That is correct, Dan. And as you say, we are in Malmesbury, and this region is called the Swartland. And we heard last week the Western Cape Health Authorities talking about vaccine hesitancy. But then we also heard from the head of health, Dr. Keith Cloete, saying that on the one hand, yes, they are concerned about vaccine hesitancy, but he is more concerned about the unequal distribution of vaccines. And he was saying that what he has found, according to the research down in this particular province, where he was talking about people in poorer areas, people in rural areas not being able to go and register, and it is for this reason that they are not that they're not registering, because they don't have access to smartphones, some of them don't have access to data, and they really want to be giving everybody an equal opportunity to register for the vaccine. And only once everybody has been given this equal opportunity, as he stressed, can we talk about vaccine hesitancy. But you're correct, I'm now joined by the Premier of the Western Cape to talk to us precisely about what you are doing to make the vaccination easier, and also to make it available to everybody in the Western Cape, because we've seen that the registration process has gone very well in the affluent areas.
So I've actually just come back from a meeting with the mayors of all the mayors of the province. We have now completed a dashboard. It's live on our website, where right down to a community, a village, a town, even our local councillors can go down, and the citizens can go and have a look where you live. And it's almost like a heat map. You can see where registrations are strong, but also where they are weak. That's number one. So we can actually visually see it. You can zoom in. We also show you all the free Wi-Fi hotspots. We have got thousands of free Wi-Fi hotspots where the citizens get 3 gigs of free data a month. We've now zero rated any registration for vaccines on all of those sites. And some of the regions, because all of our schools are connected to Wi-Fi or broadband, and so we've been using our learners as the ambassadors to try and help granny and uncle and someone down the road to get registered, and they're also utilizing the school Wi-Fi systems after school hours to also register people. So we really are, and we've also got our 70 walk-in centres, also really advertising the fact that go there to get, and we can help you with the computer system and get you registered in those sites, or younger people can come and use the free data and the Wi-Fi spots.
But you're also encouraging younger people to assist the older people to register, but at the same time you're using older people as ambassadors to encourage others to register.
Yeah, absolutely. So younger people to try and get everyone registered, and today I'm in the Swartland, and just a 30-kilometre ride away was Tannie Evita Besaidnout, and she drove through here today. We're in Westbank in the Swartland, and she had her vaccination here, also as a vaccine ambassador. Sy was hier, sy het gewys. We didn't go in with her. I think some people might have taken a shot, but it was really great to have her here speaking about vaccines, about her excitement of coming out here to get that vaccine and encouraging other people to do the same thing.
So we know that the process isn't going as fast as we'd like it to go, but you were also talking about appealing to the President, the National Minister of Health, to open up the EVD system to allow for those under 60, the 50s and up to 59, to start registering.
Absolutely. So we're speaking about getting people registered 60 and above, but we want to be complete before the end of the month with everybody who is in that cohort. So let's start now by at least registering people who are 50 to 59, so that when we get to the stage where citizens in the next of the older cohort are finished, we can start to bring the new ones in, and also pick up if there's any anomalies. We've got 720,000 people over 60 in the province, but we've got 1.5 million people who are over 50 in the province, between 50 and 59. We need to get them registered quickly. Exactly the same problems are going to come up, where people can't get connectivity, etc. So we need to start earlier rather than later. Just put it as a separate category. They won't be into the system for vaccines, but at least we'll start to build the database.
So, Premier, just before you go, we've been hearing a lot of complaints from people saying that they're getting these SMSs the night before, and also the long distances that they have to travel to go and get vaccinated. How can this be remedied?
Okay, so obviously whenever we're picking up the problems, we are raising it with the central EVDS system. We're also really pushing hard. It looks like we're getting it right now to 3 days before. We'd actually like to see it a week before, so that you can at least get your message this week to plan for your vaccine next week. That'll make it even better, but it's around about 3 days at the moment. And then, of course, remember that as the sites open up, there are more sites per square meter or per square kilometer, and of course they'll come closer. So when we first opened, we only had 6 sites, so people were getting messages to travel across town, whereas now it's going to be closer. And as more and more open up, every single week we're opening up another 30, 40, 50 sites every week, and then the private sector doing the same thing, then of course those distances to travel will become much, much less, because you'll be able to just go down the road to get your vaccine.
And are you still working on getting vaccines for this particular province?
So I haven't stopped. It hasn't been easy. I mean, all countries around the world trying it, and the existing 2 main vaccines from those 2 manufacturing companies have said they're not ready to supply sub-regional governments yet. And we're waiting to see if there's any other vaccine that gets approved by SAPRA, and of course that'll also then push us to look for those vaccines as well, because that's our next problem, is getting the supply enough vaccine into the system. You build this network, and of course we all know that Johnson & Johnson are not ready to supply yet. We know they're sitting at Gqeberha, but because of a problem in the US, that's now holding this process up, and that's also really worrying. We need to get more and more vaccines into the system as quickly as possible.
Thank you so much for your time. And Dan, there you heard from the Premier of the Western Cape talking about the getting more poorer people to register, as well as now rolling out opening up more vaccine centres in the rural areas. And he's also now appealing to national government to open up the EVDS system to allow for those 50 and under, 50 to 59, to start registering, so that they can also start getting the vaccine as soon as that phase becomes available. And I must tell you, being in the mid-50s, I am excited, and I will be one of the first ones to register as soon as I'm able to do so.
I know how that excitement goes. I got my jab this morning, phase 1, or the first dose rather, the Pfizer jab, next one in July. Thank you very much, Ayesha Ismail. We're really hoping that the vaccination rollout will be fast-tracked and the supply will be there.